One of the skills you may be asked to perform when you take your state exam is to provide client with passive range of motion exercises to one elbow and wrist. The client needs his or her elbow flexed and extended and wrist flexed and hyperextended. For testing purposes, the client needs 3 repetitions of both exercises. The instructions provided at the test site will indicate whether the exercise is to the left or right side. The role of the resident client is played by a person. The checkpoints the state evaluator will use to evaluate your performance are listed at the end of this video demonstration. Greet the client, address them by name, and introduce yourself. Explain the procedure by speaking clearly, slowly, and directly, maintaining face-to-face contact whenever possible, and ask client about personal preferences. Provide privacy with a curtain, screen, or door. Instruct client to inform you if pain is experienced during exercise. Support the client's lower arm to protect the working joint while performing range of motion for the elbow and wrist. Raise client's lower straightened arm from side position upward toward head to shoulder level and return arm down to side of body. Flexion, extension, at least 3 times unless pain is verbalized. Supporting the limb, move joint gently, slowly, and smoothly through the range of motion, discontinuing exercise if client verbalizes pain. Raise client's lower straightened arm from side position upward toward head halfway to shoulder level and support it at the wrist in this position. Bring the hand forward toward the head and then backward toward the feet, bending at the wrist. Flexion and hyperextension at least 3 times unless pain is verbalized. Supporting the limb, move joint gently, slowly, and smoothly through the range of motion, discontinuing exercise if client verbalizes pain. Lower client's arm back down to the side of body. Make sure signaling device is within reach and bed is in a low position. Wash your hands before performing your next skill or at the end of your last skill. Skill checkpoints. Does the candidate greet resident, address by name, and introduce self? Provide explanations to resident about care before, beginning, and during care. Exercise correct joints and correct side when performing range of motion. Support extremity to protect the working joint throughout range of motion exercises. Bend and straighten arm at elbow through range of motion flexion extension. Move wrist through range of motion by bending wrist to move hand down and back, flexion and hyperextension. Ask resident to report discomfort during range of motion or ask if resident has discomfort during exercises. Control extremity throughout range of motion exercises, providing smooth, slow, non-forceful movements. Ask resident about personal preferences during care. Use standard precautions and infection control measures when providing care. Ask resident about comfort or needs during care or before completed. Promote residents' rights during care. Promote resident safety during care.